everybody. Welcome to A Healthy Dose. I'm your host, Kelly, a physical therapist here in West Caldwell, and I'm happy to be joined today by Dr. Nick Freda, who is the owner, operator, and orthodontist at Marigold Pediatric Dentistry and Orthodontics in Maplewood. Thanks for being here, Dr. Nick.
Hi, Kelly. Nice. Thank you very much for having me. I'm looking forward to our conversation.
Yeah, me too. So Dr. Nick, tell us straight out of the gate, who do you help?
So I'm an orthodontist. So I help people who are looking to straighten their teeth or receive some orthodontic care. And that can be a very wide variety of or a very wide age range. We help people as young as 6 and 7 years old. And my oldest patient is in her 80s. So there's kind of never a time, our bodies are always changing. And so that we can help whether you're young or a little bit older, we can really help everyone.
Awesome. Love it. How'd you get into orthodontics and dentistry? You could speak to kind of to the whole practice.
Yeah, so for orthodontics is a specialty of dentistry. And when I was in dental school, I received some really good advice from my father. So my dad is also an orthodontist. And, looking up to him when I was younger and being a healthcare provider is what kind of helped guide me towards dentistry. But then when I was in dental school, I didn't really know exactly where I want to take that part of my career. Did I want to be a general dentist? Did I want to specialize? And he gave me some very good advice, which was to not decide, keep an open mind, and then go observe and watch many other providers. And that's what I did. So when I was observing a number of the different specialists, I found orthodontics to be fascinating. So I think it's really cool that we can take your existing body, we can move your teeth, which is fascinating in of itself, that your teeth are not locked in stone, that they can be moved, and we can, change your smile. We can broaden it. We can straighten your teeth. We can change your profile. These are all things that we can have an impact on using your existing tooth structure and kind of what Mother Nature gave you. So I just found that very fascinating. I also love that it's a relationship where some aspects of dentistry are a one-time procedure and then it's done. I like that orthodontics is more of an ongoing relationship, and you have that opportunity to interact with patients over an extended period of time, get to know them, get to know their families, and just get to know a little bit more about their lives.
Yeah. I never really thought of orthodontics like that, but I had braces twice growing up.
Yeah.
Yep, they knew birthdays, they knew grandma's birthdays, they knew driver's tests, they knew everything.
Yeah. You get to know the family, get to know the patients, and sometimes that's because I've treated a number of the family members. Other times that's not the case. I've only treated one of the family members, but you still talk to them, you still get to know, where I think of a patient very recently. I know about her nieces, who's now is in dental school. I know about her children, and I took care of her later in life and didn't take care of her children. So it's very nice that you get to have that opportunity.
Yeah, awesome. So you mentioned you observed a couple other specialties. You chose the right field or the right specialty.
So for me, it was really when you started to see results, and that doesn't happen instantaneously in orthodontics. It is, some of our treatment plans can take, 24 months and 2 years. So it's not something that happened instantly, but then when you start to see the results, you start to see, and it doesn't have to be that you're totally finished, but you see both the kind of straightening of the teeth, but also kind of a little bit of the change and the impact it has on the patient. So you see someone who come in, they're very concerned, they're very conscious about their smile, and you see them start to build some self-confidence. They feel better about themselves, and that's when I was like, okay, this is definitely the right thing for me. That's just a very cool experience and very rewarding to be a part of.
Yeah, I love it. You're getting right into it, but what's the best part then of your job?
Yeah, it's all things that we've been kind of talking about, getting to know the families, getting to know the patients, and then also having that impact on people. I think we've been wearing masks for the past year. But when we're on Zoom calls,
Yeah.
or when we are in person, and when we can finally remove our masks in person, our smile is a big part of our personality and how we interact and how our first expression towards others. So it's something that patients can be very self-conscious about, and it's very cool to both from a healthcare aspect. So our mission is health and self-confidence in our office. And so from a healthcare perspective, it's great that I can make their bite and their teeth healthier. I can also help with self-confidence. And that's something that's very cool to be a part of. And especially when it doesn't just happen with our younger patients, it can impact for our adults too. So it's something that, shouldn't be overlooked, even if we're not a teenager and going through what most people think of as the typical experience with orthodontics. I interact with adults too who say this is something I've always thought about, and it's like, well, wish you'd done it earlier, but I'm super glad to be a part of it now. Let's help you.
Yeah, love it. What do you wish that your patients knew before coming to see you?
A great question. I wish that they knew, I think that they could see me sooner. So we really like that first orthodontic visit to be at 6 or 7 years old, which most people think of, oh, why so young? And that, they don't have their adult teeth in yet. All of those things are true. In our average 6 and 7-year-old, we're not starting treatment. However, I am looking at growth and development. So our jaws are growing at that age, and we can easily kind of prevent some problems from happening that get more complicated when we're older. So at 6 or 7, I want to take that first look, and it may really be, hey, everything's great, awesome. Or it could be, hey, we need to intervene here. We see an issue with how our lower jaw is growing, our top jaw is growing, that we can work on in that aspect and hopefully prevent a problem from happening. So I think it's kind of a common misconception. Oh, we have some baby teeth. We're not ready for braces. And that's true. You may not be. In fact, most are not at 6 and 7, but seeing them younger, we can get in there, intervene sooner, and take advantage of having a lot of growth left versus when we're adults or even our late teens. Now some of those fixes become a little bit more complicated.
Yeah, it's cool. I hadn't really thought of that, but I'm a physical therapist, right? And yeah, those younger ages, everything is still growing, developing, changing, but we can absolutely influence it. And I hadn't considered influencing it from a dental or from a
yeah. But as a physical therapist, I'm sure you're aware how you rehab a teenager is going to be way different than how you rehab an adult.
Yeah, exactly. And the sooner you can get to it, the easier to fix, or the simpler.
Exactly.
Cool. So what could a new patient expect on their first visit at your office or with you?
So the first time you come in to meet us, we're going to introduce you to the team. We're going to take some photos. These photos are going to be of your smile, your profile, how your teeth fit together. We're going to sit down. We're going to discuss those findings and discuss a little bit about your treatment goals and your, what you want to accomplish. When we go through that, we will then, if needed, we'll take some x-rays. We also do a 3D scan of your teeth. And then from there, we'll kind of discuss insurance, treatment plan, time lengths. And if we have the time and you're motivated, we can even get things started. So we want it to be really a comprehensive visit. So it's some fact finding, a lot of discussion. And then we are also aware that people are very busy. So we want to kind of leave it open-ended to get as much done for you as possible on that first visit. What I think is really cool is with some of the 3D technology we have in the office. I think your brother has a scanner as well now, but I'm sure when you went through braces, when I went through braces, we had to do the putty goopy stuff and not so much fun. Now we do 3D scans and we can do a lot with that to do some digital treatment planning and help with kind of discussing and explaining both where the patient is now and where we would like to see them in the future.
Yeah. that's really cool and a whole different experience. Right?
Mhm.
I laugh because the technology has come so far kind of quickly, right? That your kids or grandkids are going to say they did what to they stuck
Yeah, oh,
what
yeah.
in your mouth?
It's really exploded across the past few years as far as some of the technological advancements. There are little pieces of it here and there when we were going through our educational process, but it's really, really changed and it's been very cool to be a part of.
Yeah, I love it. Um, I want to ask you something that just popped into my
Yep.
head, right? You're still in education, right? You still work part-time. Remind me
Yep.
where you do
So
there.
I'm a part-time faculty member at NYU. And then I also lecture for one of the dental companies, Henry Schein Orthodontics.
Yep.
So I both lecture in the academic, in the more purely academic setting of NYU. And then I also lecture more regionally Northeast for Henry Schein.
Awesome. So I would imagine, right? So that I think we're all kind of educators. But
Mhm.
there's a lot of education that goes into discussing a treatment plan and goals with patients. So can you speak a little bit to that and how those worlds have kind of collided for you?
Well, I think um, I've always loved education. I've always loved helping and explaining things. So it's kind of very rewarding to help take something that I was struggling with or had that was complex and making it as simple as I can for the person behind me. And that's why I love that educational aspect. Um, and I think that really translates to the patient experience because you are constantly having to kind of push yourself to learn more, be better, and know what kind of the newest and latest either research is or the newest and latest technology is, because that's my role as being the educator at NYU clinical floor. I don't want to get caught with a question from a resident that, oh, I've never heard of that before. So it has this motivational factor to stay at the forefront to really get as much experience. And then I think it's also makes you sit down and really brainstorm new ideas too. And so I think that's another very nice benefit in both for the educational aspect for the residents I'm working with, but then that translates to my patients as well, is that I'm trying to think, how can we do this better? How can we explain this better? How can we make this more efficient or sometimes just a better experience? And you get to play with that in both worlds for the benefit of both sides.
Yeah, that's really really neat, right? Of like you're going from very complicated information and explaining it to others in the field where you can use certain terminology and everyone's on the same page. And then you get an 8-year-old.
Yeah.
You gotta explain it to this little guy about how this stuff works.
Yeah, you bring up one of the most I think challenging things to do is to learn how to explain it to your colleagues and then learn how to explain it to someone who doesn't have that same background. And it's something that takes practice without a doubt. And I feel like that's something where we all fall on our face first as you're in school, you learn all the correct terminology, and then you turn around and go to explain it to your first patient and they look at you like you have 7 heads. And you're like, yeah, exactly. And it's like, okay, go back to the drawing board. But that process of going back to the drawing board makes you really assess what you're doing and get better at it. So I think that's a very positive thing. But yeah, the first time you do it, you're like, oh, okay, that didn't go as expected.
Yeah, you could almost see you like start to lose them, and they're like, "Yeah, sure, doc."
Exactly.
I get it. Um, that's really cool. I appreciate that that you appreciate the process behind that because it is
Yeah.
it's an evolving experience for sure. Cool. So, what types of patients have the most success with you?
So I would definitely say motivated patients have the most success. And that's because orthodontics really is, I look at it as a team sport. So you are Coach Kelly. I am your coach when you come into my office. I make kind of a silly dad joke in that I don't get to take your mouth home. You take the braces or the clear aligners or whatever, treatment technique we're using. You take that home, and I can guide you through treatment. So I try to do as much as I can, but at the end of the day, it really does take a team effort to get you a nice result, especially if we want to go quickly. So patients who are understanding of that, who realize that the more they follow the instructions, the better job they do of taking care of everything and taking care of their teeth. That's how we get there that's how we get to the result that we're both looking for as quickly as possible.
Yeah. What is one question you wish that patients asked you more?
Always, a very good question can be, let's see. Oh, I think, this is a good one. Do I really need to wear my retainer? And the answer to that is yes, you absolutely need to wear your retainer. So our teeth move and shift as a normal part of getting older. That's an unfortunate part of getting older, but it's just a part of getting older. So the same thing that allows me to move your teeth, whether you're 7 years old or 80 plus years old, is the reason you need to wear that retainer. Our teeth never stop moving. Our bodies don't stop changing. So the bite relationship usually is pretty stable. That's not going to change. But the little aesthetic things, well, they do change. So if you're consistent about your retainer, I wear mine every night. My wife wears hers every night. Then we can keep those aesthetic things that are very important to people, and important to me too. Keep them nice and stable and looking good.
Yeah. Do I really need to wear my retainer?
Yeah.
Love it. Yeah, growing up in a dental family, we learned that one. All four of us learned that one.
Good.
Awesome. So what would you say maybe are like the top 2 or 3 things that you're most comfortable and confident in treating?
So I'm a specialist, and so I focused my career down to orthodontics. But within even orthodontics, I would say what I feel the most confident is what I kind of lecture on as well. And I lecture on fixing overbites and underbites. So if your teeth are a little too far forward, or if you're reversed, where your lower teeth are ahead of your bottom teeth, that's what I focus a lot of my lecturing on. So I feel very confident and comfortable treating both of those type of cases. And if you kind of think of the old school way of using headgear, well, we have a lot of new techniques that we do not have to use headgear anymore. So the Darla from Finding Nemo look is no longer how we approach that problem. And so we can help you there. And then with underbites, the more common way, the more traditional way was just to say, we're going to do surgery. And surgery can do some wonderful things, but that's not always realistic for everybody, whether that's from an insurance perspective and a cost perspective, and sometimes just not comfortable doing surgery. Well, we have some options there as well to help address that and fix that and get you to a good place without having to go that more traditional route.
Yeah. I'm going to ask you more of like from just a general curiosity, right? If someone didn't fix an overbite or an underbite, what are the grander kind of health consequences for that?
So when our teeth are a little too far ahead of us, or we have that underbite relationship, when we're not biting down the way we would like to, and if you think of it, we want more like our fingernails overlapping versus really out ahead or behind, you're going to wear your teeth down faster than you would like. And you're putting pressure on those teeth in ways that they're not designed to. So it's designed to kind of bite and tear into our food. If it's reversed or too far out ahead, we're not providing the pressure in the way we normally would. So you're either grinding your teeth down faster, or you're wearing down the support system. So our teeth are in bone and gums, right? And that's the support tissue that is holding that. And if it's not getting the correct system, the system is out of balance, you're going to wear it down faster. It's going to break down faster. So you're going to have more difficulty maintaining your teeth long term. So that's not something that's going to happen tomorrow, but we're not talking on a tomorrow time scale. I'm hoping you keep your teeth the whole rest of your life, right? We are gone past the days when everyone gets their teeth taken out and you get a set of dentures. We want to see people keeping their teeth, hopefully their whole lives.
Yeah. Well said. Spoken like a true professor to a true novice.
Yeah.
Awesome. So, is that safe to say that those might be your favorite cases to treat, the overbites or the underbites, or is there?
So it's definitely underbites are some of my favorites because they're challenging. So they're not easy, but I like that challenge, and I like the change it has in that patient. So it's usually someone, everyone's aware of what an underbite is. Not everyone knows what an overbite is. Everyone knows what an underbite is. And I think it's something that people can be very self-conscious about. It's something that they didn't think was necessarily fixable.
Yep.
So it's something that doesn't happen instantaneously, doesn't happen overnight, but can be very rewarding to guide the patient through that journey. And then they're very grateful afterwards. So it's something that is very cool to be a part of. And yeah, so those are probably some of my favorites. Not to say I don't like doing some of the other things. I really like cases as well that I have an opportunity to work with some of my other colleagues in the field. So whether that's setting someone up for an implant, doing some of the cases that do require surgery with the oral surgeon, bringing in a tooth that was, say, impacted, which is a fancy word for stuck in the bone. Those can also be very rewarding because you get to work with some of your colleagues. I think that's one of the nice things about my wife and I opening a practice together is now we have two specialties in the office. We get to bounce ideas off of each other. We get to take care of our patients in a more holistic approach, and the fact that it's taking care of multiple aspects of dentistry under one roof.
Yeah, that's really cool. I love that. Can you tell me a time where maybe you talked about like working with other specialists, right? Or working with colleagues, right? Where maybe you said, hey, I'm not the right person to treat this, but I know somebody who is, or we've tried this and we're better off taking a different direction. Can you tell me a story about that?
So I think with experience, you are able to visualize the treatment outcome a lot better, and knowing what can be fixed with orthodontics alone versus what needs to be addressed with either can't be addressed with orthodontics or orthodontics is one part of it. And I feel like I've gotten much better at that with experience. Is okay, so here's where I can take it with orthodontics, and this is where I need to say pass the baton to get you the result you're looking for. Maybe we need to do a crown or a veneer or an implant, how we can set those type of cases up. I think of a case very recently. It was a young individual who was born without multiple teeth. So she was missing 5 teeth, and we set it up. So, okay. And it was a very cool experience to think about. All right, so we're missing 5 teeth. Is there a way that we can set up and minimize the number of implants that she needs? Because no one's made of money. So how can we minimize while still making it look like she was born with all of her teeth? So if I had approached that in just my bubble and said, here's braces can fix all of this, it wouldn't have been a nice outcome. So brainstorming, how can we set everything up so I can then pass it over to the periodontist who's going to place the implants and the prosthodontist who is going to then restore them. That was a really cool experience. And that's something that I needed more to be a little further into my career to be able to visualize from day one. So now I can have that conversation in that initial consultation, talk to the patient, let them be prepared and know what's going to happen, so that it's just less confusion and everyone's on the same page. So I think previously I wouldn't have been able to do that. And now I feel very confident with that, and knowing kind of what I can accomplish with orthodontics and what needs, some other options that we have in the dental field.
Yeah. Awesome. So along that line, but on the flip side, right? Maybe what's like unique or interesting case that you were able to help somebody with, or you saw the results and got excited.
Yeah. So, I mean, that definitely cases that are missing teeth,
Yeah.
you are really cool to see the end result, because usually that's something that that's again someone who's not confident smiling, doesn't feel comfortable within themselves, and you can see the huge change once you've given them teeth. I don't think there's a time in your life where you would feel comfortable without one of your front teeth. Maybe when you're really little and you lose that first tooth,
Yep.
but after that, not having some front teeth is a big deal to your ability to interact with your peers. So I think that is a wonderful experience to be a part of, very rewarding to see that journey go through. So I think that is amazing experience to be a part of.
Yeah. That's cool. It's almost as you're speaking to that, I was thinking of like a lot of healthcare is just a puzzle.
Mm-hmm.
Like especially in orthodontics and dentistry, right? That's just a big puzzle, right? Of getting the right pieces in the right places. If you're missing a piece, then you got to go to the puzzle making factory, right? And design the perfect thing that's gonna complete the puzzle. And I think that's just a really cool. And my brother had talked about this when I interviewed him, of like the art and the science of it, and those two worlds colliding, and being able to provide that for somebody to then give them the social confidence and ability to live a life that they want.
Yeah.
Based off of those puzzle pieces. It's really cool.
And I love that analogy, because even though the conception may be that, oh, I do braces, I do aligners, everyone gets the same thing. That's not true at all. Everyone's mouth is totally unique. And so much of the industry is moving towards how do we customize it as much as possible for each patient. And we've always customized it. Orthodontics has always customized it but it used to be saying bending lots of wires and detailing it chair side with the patient physically in the office. Well, now it's going to, with the advent of 3D printers, it's how do we customize it digitally, and how do we do some of that digital treatment planning, which is really cool, because in the near future, we're going to be talking about really every bracket being unique for every patient. The wires being unique for every patient. We're making custom aligners for everyone. We 3D print things in-house that are really not going to fit in anyone else, just going to fit on you. And it's how do we, to your point, how do we take that puzzle of that patient, and instead of taking something just off the shelf that previously and customizing it more by hand, we're doing it digitally, and going from, just like the rest of our world is going from analog to digital, it's how do we bring that into the orthodontic world as well.
Yeah. Awesome. I love it. Is there anything, well, I'll ask it this way, right? How do you best like practice what you preach, right? You mentioned you had braces.
Mm-hmm.
And I don't think there are kids in your direct world yet, right? But if you had a 6 or 7 year old, or like if you had a niece or nephew or somebody, how would you best practice or I guess practice what you preach?
Well, step one to practice what I preach. I do wear my retainer every night.
There we go. All right.
Yeah. So that's definitely one of the things. And then if it was a family member, or my wife and I are looking to start a family soon. So when it's time for our children, it would be to take care of them, starting with brushing our teeth, of course, right? And an orthodontist, but we don't stray away from the basics. We got to brush and floss. Yep. And then from there, it would be that's age 6 or 7 visit to make sure that we're monitoring and tracking everything, watching how our children are growing, and then emphasizing with them when they're older how to take care of the braces, how to take care of the aligners that we give them, so that the home care is good, so they're following instructions, so they're motivated when they're in treatment. I'm sure that'll be a challenge especially when it's my own children, right? And then, of course, setting up good foundations for the future with them wearing their retainers and having good oral care, their 6-month visits with their dentist, and taking care of their oral health.
Yeah, love it. Yeah, I'm gonna play this back for you in like 10 years.
Yeah, I look forward to it.
Awesome. So, Dr. Nick, I have a couple more questions for you. I
Yeah.
really appreciate you taking the time. If a patient needed you after hours, what's that process like, right?
So we are available after hours and to help our patients, whether it's a question or something just doesn't feel right in an emergency. Again, a nice thing about working with a multi-specialty office is that I have covered emergencies and concerns for my wife's patients, and she has equally covered questions and concerns for my patients, so that there's just more availability for our patients, because it's going to be a team effort and you don't have to worry about how are they communicating, because we communicate quite well, and it's something where we're adept at and experienced at, kind of covering both sides of the specialty. And that pedo ortho really, although I see adults, she focuses just on children. So we're able to kind of take care of that whole family environment together. So we can really help each other a lot there.
Yeah. Love it. Cool. So my final question before I ask it, I just want to say thank you again and acknowledge you for the services that you provide for the
Thank you.
community, and for taking the time to come on and talk with me.
Well, this has been a pleasure. Thank you for having me.
Yeah, of course, of course, of course. So last question is, where's your office, and what's the best way for someone, if they want to become a new patient, to reach out to you?
So our office is in Maplewood, New Jersey. The address is 1715 Springfield Ave. Our website is marigoldpdo.com. So it's Marigold Pediatric Dentistry and Orthodontics is our business. So marigoldpdo.com. So you can find us on our website. We are currently updating our website, so maybe by the time this comes out, it probably will be the new website. And then our phone number is 973-821-7161.
Awesome. And I will link all that up in like the description. And
Perfect.
so people will have easy access to all of that. But that is awesome. Is there anything else you want everyone to know about you?
I really love Legos. So that's my hobby and my passion.
Awesome.
So when you come to the office, I think you'll see some of the ones I have that we're using to kind of decorate and try and make it feel a little bit more reflective of our personalities. We design our office to feel a little homey, so it's not as that's kind of how we approach the design of it, as much as possible, right? Dental office is never going to feel exactly like your living room, but we try to do it that way. We try to make it reflective of myself and my wife's personality, and we had some shiplap around kind of the entrance, and then we made it kind of a more homey decor. We do have TVs and stuff in each of the rooms so that our patients can feel comfortable when they're in the dental setting, and when they're getting used to being at the dentist, because she sees patients as young as 1 year old. So it's definitely for some their first dental experience. And so we tried to design the office that way. And then we also did our best to incorporate the latest technology. So we have a 3D scanner. We have ultra low dose digital x-rays. We are trying to make it a good experience, a wholesome experience, and create kind of a dental home, so to speak, for our patients.
Love it. I got to ask you about the Legos. What's like your pride and joy? What's one that you've built that you're like, I like this one goes on the top shelf?
So that would probably be the Saturn V, the Apollo rocket. So it's a big one. It's a big set, and that was a Christmas present. So that was something that got a nice little present, a very nice surprise. And that's probably my favorite one. That's a nice big set too.
I love it. I'm gonna have you snap a picture of it and send it to me. I'm gonna put it in at the end here.
We can do that for you.
I would love that. It's funny you say that because Greg and I growing up, that was our every Christmas we'd get a huge set, and that's how I learned a lot of teamwork, right? And had like give me
I
ones.
I can't even imagine. None of my siblings would have had the patience to help me to sit down and do that. They would look at the directions and go, "Not for me." So Greg was very lucky to have a team member there. And then I think he sent some photos recently of one of his sons getting into Legos as well.
Yes, yeah, they're all about it, which is great. Awesome.
Yeah.
Awesome. I love it. Well, again, thank you so much for being here.
Oh, thank you so much for having me on. This was a lot of fun.